All right, so today we're going to talk a little bit about knee pain, and the first thing you want to consider when you're dealing with knee pain is if it's something serious, you're dealing with some serious sharp pains, you know that something's not right, then obviously the first thing that you want to do is go talk to a medical provider. But a lot of times we can kind of get some low-grade knee pain due to inflammation in the knee joint, maltracking of the patella, right? So when you think of your kneecap, right, when any of the muscles, tendons, ligaments that kind of cross that knee joint are tight and can kind of pull that kneecap out of position, right? If you just think about it, the joint's not centered, right? You're getting some rubbing, you're getting some inflammation, you get some pain there. So this is a pretty standard protocol that I've found has worked great for myself over the years, and for a lot of other people when they're kind of dealing with that mild knee pain that might be due to some inflammation and things not tracking right in the knee joint itself, right? And so when we think about joint pain, one of the things you want to consider is what's happening, below and above the joint. Because if you've got things that are tight or that are causing the knee not to track correctly, right, the first place to start is directly above, directly below the joint. So there's four kind of little drills that I like to use. They're not all inclusive, but these tend to work pretty well. And the first part that I'm going to start at is doing some soft tissue work for the quads, for the IT band. All right. So I really like to use a rolling pin or a barbell. Works really good. You can use a foam roller as well. And kind of what I'll do is I'll just go about 30 seconds down the center of the quad, really focusing on those areas that are tight. Right. So if I'm feeling there's some tension there, I'm going to kind of go back and forth, right? I'll spend about 30 seconds working along the inner portion of the quad, right? And then I'll come to the outside of the thigh and the quad right there, work that for about 30 seconds. All right, then I'll get on the foam roller and kind of hit we got the ABS pipe here. That works good, a little bit tougher, right? And just kind of roll back and forth along the side of the IT band there. So that's 2 minutes per leg on that one right there. Another good spot that I like to go to then, so we're working that quad that's directly above the knee. Kind of continue to talk about the quad and the hip flexor. Wall stretch is a really good one, right? Back knee up against the wall or anything you can find, right? The tighter you are, the further away you have to be. All right, so start kind of pretty far out away from the wall, and then what you can do is kind of slowly push the hip down towards the ground. So I'll spend about a minute here. And again, if you're not getting a deep stretch, you can slowly start working that back knee closer and closer to your wall or whatever you're stretching up against here. All right, so again, start further out, slowly work your way in. And then after about a minute there, slowly, come up slowly, because again, if there's too much tension through the quad, through the hip flexor here, back your knee away from the wall. But I slowly come up, right? And as I get more and more vertical, I don't want to be down here. I want to be as upright as it can be. Get a nice deep stretch through the hip flexor here in a minute in this position. And then again, come out nice, slow, with control. So again, 2 minutes each leg, doing kind of that static wall stretch there. Another kind of area I like to focus in on, above the knee joint, hamstring group of muscles. So take a band, wrap around the foot, and we're going to go kind of PNF stretch here. So pull for about 10 seconds, push against that band for about a 5 count. Then pull for another 10. And again, each time I pull, I should be getting that thigh closer and closer to the chest. Push for 5 count, aggressively driving against that band. And then get your pull coming in. All right, and I'll just alternate between doing 5-second push against the band, 10-second pull for 2 minutes. Again, 2 minutes each leg. And then the last one, all right, kind of we got our calves down here, below the knee joint. Again, if they're tight, that can cause some knee issues. So what I'll do here, right, get up against a post, whatever you can find. Keep the knee straight, pull straight in for about 30 seconds. Then you can go ahead and bend that knee, drive that knee into the post. I'm going to feel a stretch a little bit more in the ankle. Kind of 30 seconds in this position. Let that knee come inside the foot, 30 seconds from in here. Right, and then as I come out, I'll kind of push that knee just outside the foot, 30 seconds in that position. All right, and again, nothing should ever be painful when you're doing these drills, right? Start out real mild, gentle with your drills, and then increase kind of your intensity as you can get into a deeper stretch, things like that. So that's some of your drills that you can utilize for that kind of low grade kind of knee pain.